How you doing, guys? So this is Dr. Sa at Specific Chiropractic. So in this video we're going to talk about, well, you've been having what? Neck pain, low back pain, both your shoulder pain, all because your mattress is too firm, right? Anything else?
No, not really.
Okay, so all right, so we're going to get right down to it. Let's take a look, see what's going on, and we'll take it from there. Okay. Since you're talking about you believe your mattress is too firm, right? And it causes your body to, well, can you clarify more? What kind of neck pain have you been experiencing?
Just like a lot of pressure on my neck and my shoulder, my shoulder blades. Like on a lot of pressure on my joints, like all over. Gotcha.
Okay, so suffice to say, we want a little softer mattress in your case, since you're more petite and a little more lightweight. So in your case, you probably want either like a medium type of mattress. Instead of the current one, you're using the purple brand, right?
Yeah.
So that's a medium firm type of mattress. So since that's giving you problems, stick with a medium or a plush medium.
Yeah.
Go with that kind of style, all right? And then in terms of biomechanics of spine over here, in terms of you feeling some pressure on your shoulders and your neck and also on your hips and your lower back.
Yeah.
So, well, there's some interesting things I'm noticing here biomechanically, right? Now, I want to see how your foundation is. Your foundation is supposed to be leveled, but however, it's tilting downwards this way. And the things that make it go down this way, I'm expecting there should be what we call a PIEX or PIX type of misalignment. That means the hip over here, it went backwards and also rotated this way. That's my expectation. However, it's doing the opposite, okay? Your hip instead, it went forward and also internal rotation, okay? Why is it doing that? Well, that comes to the next biomechanical issue as well. I strongly believe you have an anatomical short leg on your left leg. Now, the reason why it would do this type of misalignment by going forward and inwards, because when it does this, when it goes into anterior, AS and IN type of misalignment, okay, it actually makes the leg a little longer. So since you're anatomically short on the left leg, and your body is deliberately trying to misalignment to try to compensate for that short leg, try to make it a little bit longer, but it just wasn't enough. So as a result of that shortfall being still, as you can see over here, and the viewers can see as well, you're still being a little lopsided over here. Well, all it takes is a slight little lean like this way, and we can't walk this way, right? So your body started adapting, compensating from here, needing a little more, and over here, in towards this direction. I said, my head gotta be level here. The mid back start rotating this way, tilt this way, and then that way. So now we have all those pressure points like that. Yeah, so what we wanna do is, we wanna address here. But the other thing is this, okay? I see these parallel lines, okay? There should be a slight little wedge in there, okay? But no, exactly level over here. So when I see a thing like this, my expectation is you may have a possible base posterior sacrum. That means this foundation itself went backwards itself. So I'm going to confirm that on you. Now, the other component as I'm also considering is this. As we start to adjust and stabilize this, if that is indeed the case that we find during examination, this is a point, just a little tip and pointers for the Gonstead students and the young docs, okay? By continually adjusting this fellow over here, or this, but most likely this sacrum over here, it's steadily gonna make this even more lopsided, okay? So I'm gonna keep an eye on that and see if you may need a heel lift to re-level it this way, okay? So therefore, I'm gonna double check an examination. Do you have this problem over here? Then I'm gonna see how this fellow is doing over here, your fourth lumbar, and then your sixth dorsal, second dorsal, and also that sixth cervical as well, to recenter and take that pressure off of that atlas over here that's rotated so forward it went interiorwards on the right hand side. And I believe you did mention about, your eyesight gets blurry and you get the headache on the right side, okay? Yeah, it's because the atlas itself is being rotated so much by going this direction over here. So to recenter the atlas, I have to recenter most likely that sixth cervical, which slightly went to the right over here, to bring it back to a proper alignment like this. Meaning, since your body itself, this atlas over here went this way, I'm gonna find, and that's the first PR I find, posterior and right rotation right here. By adjusting this and recenter it, it's gonna pull the rest of the body that way as well. We're gonna start off examination with visualization. Where's the muscle spasms? Where's the swelling? Okay. So up here, yeah, we see there's something swollen up here. Same thing as well. Feel that muscle tightness here?
Yeah.
Yeah, right? Mm-hmm. So clearly our body, okay, all these muscle tightness or spasms is trying to stabilize here. So it tells me, no, there's something unstable here. In addition to, while I'm touching, okay, I'm palpating, this region over here, especially on the right-hand side, is much more warmer than the rest of the areas of our neck. Okay, so clearly there's something going on here. We're gonna take a closer look on that fella. Okay, same story as over here. There's some pitting edema, some swelling over here. And we can also hear it too. See, because there's more fluid in here, the sound is gonna be different. See, it's not the same sound. So again, this fluid over here is acting like an airbag or a cushion, trying to stabilize here. But the trade-off is that the nerves, this region over here, innervates the thyroid and the shoulders. So in terms of shoulder complex, that could be the explanation why she feels that discomfort over there. Same story over here. We got a potential issue right there. And we can see over here, this is very puffy around this fourth lumbar region over here. But here's another telltale clue in terms of the base posterior sacrum. So when we take a look over here, look at this. This is all this adenomous fluid. It's all filled up. This is like a water bed over here. Okay, this is not fat. See how bouncy this is? It's all fluid. And it's not just, usually when there's a rotated sacrum, if it's rotated on this side or that side, we want to see the fluid and the tenderness, everything, all the indications on one particular side. But no, I'm seeing on base on both sides itself. So a base posterior means the sacrum is somewhat backwards this way and it's going to inflame on both sides. So therefore, my expectation is tender right there? Yeah. Yeah. What about here?
Not too much.
Not too much, but it's still there.
Yeah.
Right? So now we're just going to check it. Feel that right there?
Mm-hmm.
Okay. Tender when I did that?
Yeah.
Yeah. What about this here? Not too bad. Right? But still tender here, right? So this is all stuck right here. Right side, the middle of it, and the left side of the sacrum. All of it is all fixated and stuck. So that confirms more indication of a base posterior sacrum over here. How's this fellow over here? Not too far no there either, right?
Yeah.
Yeah. So yeah, we got some swelling over here. Okay. Yep. Got some potential over here as well. So we're going to keep an eye on that left hip over there. So now with instrumentation, see how much that fellow is moving over to the right at this level. So we got one potential here. Scanning the rest of the spine. See, we've got another 3 points to the right at that fourth lumbar level. See, we got even more so 5 points to the right on that sacrum level region right there. See if there's anything lower than that. See, that's just heat reading down there. Yeah, slide 2 points to the right. Let's see what's going on in the neck here. Yeah, look at that. Slide, yeah. Got some nerve pressure right there, I bet. Yeah. So there is a very slight little heat reading to the right at the atlas level. Very slight, but it's not significant enough. So we're now just gonna take a look, see what's going on here, 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 and there. Feel that fella right there?
Mm-hmm.
Okay, it's not moving too well right there. See, that left hip is partially fixated. But the sacrum here, that's a brick wall. You feel that? That ain't budging. None of this is. How's that feel right there?
That's good.
See, this fourth lumbar is not too great either. And we take a look at the x-rays. We're overlaying all the data. I'm using that x-ray as a blueprint, as a framework. And I'm overlaying all the active dynamic data we're accumulating right now, all the objective data right on top of the x-ray image. Because we want to create that 3D, live 3D image in our mind, see what's going on, see where the potential biomechanical issues are, and address those fellas. Now you feel that big knot on the left-hand side? Mm-hmm. Yeah. See, you also feel that same thing as well on the right-hand side? Mm-hmm. Yeah. How's that poor fella right there? Tender right there?
Yeah.
Yeah. What about this one here? Not too bad?
Not as bad.
But the bottom, number 6. 6 cervical. You got it. And now, how's the swelling over here?
More on the left side.
More on the left side. But what about this fella right here?
Yeah.
See, that's your atlas right there. So it's a bit swollen, but not crazy swollen. See, now we're gonna test it. See, you have some decent range of motion, but it's not great. So because of this is a partial fixation, okay, that tells me, no, this is actually compensation. So therefore, I'm not gonna try to adjust that atlas alone, okay? We're gonna leave that fellow alone. When we start addressing from the ground upwards, it's gonna help. Take all that rotation out of your atlas, and then you're gonna get some more nerve function the rest of your body there. Okay, so let's rock and roll.
Okay.
Okay, let it go. Okay, come on up. Walk around.
Much better.
What's much better?
The pain that I was feeling on the left side.
Okay. Any other difference you notice right now?
Just felt much lighter.
Good. How's the shoulders and the neck doing?
Yeah, much better.
Nice. There's a piece. There's that fella. So your second dorsal is a bit jammed. So now we're going to test. So your SC is a little bit stuck. You feel that right there?
Yeah.
Doesn't move too well. Feel that? It's even more stuck. Okay. So the reason why is you feeling that little more fixation on this side versus this side is because the way your second dorsal vertebrae is rotated so much, okay, on that side, is causing your clavicle and the ribs to stick out a little more on the side. Okay, so that's why this is jamming up a bit. So we'll go ahead, we're going to address the second dorsal right now. There it is. A little flexible there. There's that fella. Feel that now?
Mm-hmm.
What's different about that fella?
It's moving more better.
Okay. What about this one?
Still a lot of tense though.
Do you feel that right there?
Mm-hmm.
It's moving differently, right?
Yeah.
Yeah. So now we're going to get to the next part. So the next part is the 6th cervical, because this fellow over here still has nerve function going into that shoulder there. There's that fellow. Okay. Good. How's this now?
Much better.
All right, go ahead, walk around, see you like it.
Yeah, it feels so much better.
Okay, what's different right now?
I can feel like the tension on my muscles feels much more lighter.
Okay, anything else?
My posture feels better.
Okay, and what else?
It relieved some of the pain that I had on my neck, like the tension that I had right here.
Nice, nice. Okay, so this is going to be the story over here, okay? I want you to follow our cold pack protocol over here. We're going to calm this fellow, we're going to pump all that fluid, all the swelling out of the way. So from here, here, and down there as well. As it does so, you're gonna start noticing some other changes as well. You let us know how things are on the next visit.
Okay.
All right?
Thank you.
Oh, you're very welcome. I'll see you next time.
Thank you.